Well, good afternoon, everyone. This is Lloyd with AVS Medical. Thank you for taking time out of your busy day today to join us as we present how to evaluate your practice. Excuse me, I'm not sure what that background noise is,
Sorry
but
about that.
okay, how to evaluate your practice's financial health using the tools that are in your Medisoft software. Sorry that we're a little bit late. We've got a big crowd and there's still people joining us, but we're a little bit after the hour, so we're going to go ahead and get started here. Before I turn things over to my partner Cindy, let me just run through a very quick housekeeping detail. This webinar is being recorded and it will be available, should be available by tomorrow, if not by Monday at the absolute latest, but I'm pretty sure you should see it tomorrow. It will be available on the avsmedical.com blog page, and going forward, we will be putting a lot of what we think of as best practices up on the Medisoft blog next week and in the coming weeks. So I would encourage everybody to go there and register, and you'll be notified as soon as those are posted. If the GoToWebinar control panel is taking up your screen and you can't see the full screen, you can minimize it by clicking that little white arrow with a red background in the upper left-hand corner of the GoToWebinar control panel. And then lastly, once we're done the webinar, if you want to ask a question, you'll be able to click that little hand icon and I can unmute your phone line. Or if you prefer, you can type a question into that chat box and I'll read the question and answer it live for everybody. So without any further ado, let me turn things over to our in-house Medisoft expert, my partner Cindy. Cindy, are you there?
I'm here.
All right, take it away.
Good afternoon.
Okay.
Good afternoon, everyone. I would think quite a few people that are on the call with me are Medisoft experts as well. A lot of us have been using Medisoft for many, many years, but it's always good to take a look at what new things have been added to use in your Medisoft, along with maybe a chance to revisit and take the temperature of your practice financials. And that's the theme of our agenda today. We're really going to do a quick overview of a quick way to assess the health of your practice. And in order to do that, we're going to run 3 reports, and I'm just going to kind of breeze through those. Many of you have probably already produced these reports, but once we do that, we're going to go ahead and take a measurement of the health of your practice, take a look at what areas might need to be fixed or treated, and then we'll devise a treatment plan. We've got a lot of suggestions for you as to how to attack your outstanding AR, how you can work on improving the front desk collections, what tools we have to help you with insurance claims. And then at the end of the presentation, we will give you an email address if you would like to request a no-charge, professionally prepared practice analysis. EMDs, that's the company that purchased from McKesson Medisoft. And EMDs does have a division that does medical billing. They also have some resources and tools available for us to use. So I'll show you a little screenshot of what that practice analysis report looks like. And if you want to get one, we'll be happy to work with you to get that from them. That practice analysis report that I would like to ask that you run is the first part of taking the measurement of how the practice financials are doing. And when you run that report, you want to choose a representative 12-month period. Make sure you choose 12 months where you've really had a chance to post as much of typical insurance and patient payments as possible. So I usually suggest to go with last fiscal year. Certainly, there's been plenty of time in 2016 to post as much activity as you were going to for 2015. But certainly, if you want to choose, if you're really up to date on your posting, you could run a 12-month period, let's say from April 1st of 2016, and the previous 12 months. That report's going to give you the total charges, which is really the number that we're going to use in our calculation today. It also gives you total payments and adjustments. It'll show you the revenue by CPT code and then show you the average charge for CPT code. And most of you probably already know where to find this report, but it is under Reports in Medisoft. Go to Medisoft Reports Professional. And then on the left-hand side, the folder you would select is Medisoft Reports again. And the one I'm looking for here is Practice Analysis with Practice Totals. I've got a sample database that we're going to generate this report for. And first of all, go ahead and fill in the dates for that 12-month period that I mentioned. For those of you who don't know the difference between date from and date created in Medisoft, date from refers to the dates of service. Date created is the physical date that you entered something into your computer, so whatever the Windows date was. So when we're looking for activity by dates of service, we're always going to choose the date from. This is the practice analysis report from my sample practice here, and it's nice to review just to see what type of procedure codes, what is your current fee schedule, whether you feel that's up to date. But I'm really looking for the totals. So on the final page of the practice analysis, you'll see the total charges for that year, for that 12-month period, and we're going to use that again in a moment. The second report is the production by provider. For this report, use the same date range as you chose for the practice analysis. And what you're looking for here is the provider activity. So if you've got more than one provider, this is going to really come in into play. And to find this report, again, it'll be Medisoft Reports. The folder is, again, Medisoft Reports on the left-hand side, and it's production by provider. Make sure to run the summary here because you don't want too many pages of the report. We're really trying to look for the total 12-month activity level. I ran it again for the year 2015, and I'm looking for two things here. I want to make sure that the charges at the bottom total the charges from the practice analysis report. They should be the same. And then also I'm taking a look at I've got 4 providers here in my particular practice, but I'm looking to see percentage-wise, am I having problems with a certain one of the providers in my practice versus is it just generally across the board that I'm having problems with receivables. The third report will be the all-payer aging report, and this is really the big one. This is where we're going to take a look at insurance aging versus patient aging. And do I have problems in one area or both? Because when we come up with our treatment plan, how to improve the financial picture for the practice, we're really going to decide which areas to narrow in on first. We're going to take a look at the potential problems with certain insurance carriers. Maybe everything's going well except with one particular carrier. And then we're going to take a look at that patient aging. The patient statements that are going out now become so much more important because of the trend for businesses to purchase insurance that has a high deductible. Everybody knows that medical insurance is so expensive that many employers have decided to use not only high deductibles but high co-insurance. And therefore, a lot of the balance that's going to be due is responsibility to the patient. One of the things many of our practices that we work with have started to use is the professional-looking bill flash statements. We've had webinars on bill flash in the past, but that's the ability to go ahead and have your statements mailed out. They're very professional-looking. They come with a self-enclosed envelope. And it also includes information on the statement that shows where the patient can make an online payment. And I don't know about everybody on the call, but I pay almost every bill electronically anymore. I don't like to have to find a stamp to mail an envelope for the bill. So I think many of our patients are the same and would appreciate a way to pay online. One of the big things we're going to talk about today is also the collection policy at the front desk. If patients have an outstanding balance, is the front desk able to comfortably speak with the patient and offer a payment plan at the time, knowing that the office policy is that we do or we do not treat patients that have an outstanding balance? Perhaps if you've got something already pre-prepared that you can hand to a patient that shows their payment plan, that can really help in getting those patient receivables addressed. To get that all-payer aging report, we're going to go back to that same folder again in Medisoft Reports and go to the, oh, I apologize, it's the Aging Power Pack. On the left-hand side of the screen, we've got Aging Power Pack open. We'll go to the All-Payer Aging Report and run that. And that summary really gives you a snapshot of two things. First of all, which is the problem area? Is it in insurance or is it inpatient remainder? Secondly, which bucket are these falling into? And I'm going to show you in a minute how we're going to compare your results from this report to the national benchmark from the MGMA. So we're looking at the 30, 60, 90, 120, and 120 plus, and really kind of zero in on what needs to be addressed in your practice. So we've got our initial reports generated, and now we're ready to do that key performance indicator, which is called days in AR. And if you've not worked with days in AR before, I've got the calculation here. You're going to, first of all, get that total annual charges from your 12-month report, which we got on the practice analysis. And then you're going to have your total AR. That's the patient and insurance aging together. To do the calculation, we're going to do receivables over charges per day. So let me show you how you would calculate that by using a sample practice. First of all, of course, you know what your total AR is. That is all the receivables, insurance and patient. But your charges per day is calculated by taking the total annual charges. And for my sample practice here, it's $2.8 million for the year. I divided it by 365 days to come up with $7,671 a day. So on average, my sample practice is charging that much per day. And in order to do the calculation for the days in AR, we're going to take that $450,000 in AR and divided it by the average charges per day, which was the 7,671, to come up with our days in AR at 58.66 days. So that means if you treat a patient today, your average collection time is going to be almost 2 months. And that's not good. So how do you know if your days in AR is going to be good or not? Well, you're going to want to compare your number to the national benchmark. The MGMA goes out annually and requests many of its members to submit data so that they can expose that on a national basis to the entire group. If you're not already a member of the management group, MGMA, I would suggest that you join them. They have a great financial blog. They also have all kinds of financial resources on their website. But this is from 2015, and you'll notice that they've got three different kinds of practices: primary care, surgical, and multi-specialty. And the idea of this graph is that in gold, we're showing the better performing practices financially. And the turquoise blue there is the non-better performers. So if we look at primary care, it's saying that better performers should expect to see their money in 23.54 days. And if you remember our sample practice, it was more like 56 days. So they're not even near the better performing practices here. From their survey, the non-better performers in the primary care were around 40 days. So in general, if you're between 30 and 40 days, you're getting closer to what a better performer would look like. The other thing we talked about is not only how many days that you're waiting to see payment on average, but taking a look at the insurance aging versus the patient aging. So let's take a look at the MGMA benchmark for that. The MGMA says that in their data for these better performing practices, you would expect that about 60% of your receivables is in that 0 to 30 day bucket. In our example, only 40% was in that first bucket. The reason we expect to see a very high number in the first bucket is if you're getting paid in 23 to 30 days, then your receivables should all be in that very new area or the current bucket of your receivables. And then for the MGMA, it should get very low for the 30, 60, the 90 bucket, but the 120 plus has all your problem claims or statements that haven't been paid in at least 100 or over 120 days. So for our example, on the right-hand side, our sample practice is going to, as they improve the really old aging, they're going to push a lot of those receivables up into that 0 to 30 day, and the whole practice is going to experience a much quicker cash flow. Now, if you've decided that insurance balances are a problem for the practice, then we've got a few suggestions here as to what you can do to improve the speed of your AR days for insurance. First of all, make sure you're using Revenue Manager in Medisoft. If you're sending claims to someone other than Relay Health, you may not be using Revenue Manager, but you want to start using it so it does that initial scrub. It checks your claims to make sure that the basic information is there before you upload them to the website. And then no matter which clearinghouse you use, make sure you log in on a daily basis and check for rejected claims and potential denials at the clearinghouse. And just try to keep up as much as possible so none of that, you don't get behind in reviewing that situation. You want to attack denials immediately, whether you have to schedule that every week so that you have time to really dedicate to dig into why it was denied and then resubmit those claims in a timely basis. That insurance aging report, that aging power pack, it really would show you in detail by carrier who's got all the receivables. And you want to go in and identify them. If you don't want to identify them on paper, there is a tool in Medisoft that you may or may not be using now called the collection list. And I'm going to show you how to use that collection list. This is the aging summary report, first of all, which would tell us on paper or on the screen, show us what's going on in all the different carriers. And you could print that out. But if you use this collection list, the Medisoft software will go in and show you in a grid what your aging looks like, and then you can attack it.
You're going to bury it here?
This can be found under Activities in Medisoft, and then you'll see that I've highlighted the Add Collection List item. Right above that is going to be the collection list itself. And the concept of this tool is that you would go in and identify groups of claims or groups of patient statements that you want to work on. So first of all, you have to add people into the list. So you'll go to Add Collection List item, and once there, you'll get a screen like this. Up at the top, you'll notice that you could choose either statements or claims. And for my example here, I've selected claims, and I want to look at primary claims. And then make sure to enter in the billing dates that you're most interested in. Now, for some reason, I put in there 1 day. I didn't mean to. It should be more like a range of dates. It would be, for example, March 1st of 2016 to maybe June. And I'm looking at that aging period. And at the bottom, you want to make sure you assign it to a user. And I assigned it to myself. I'm AVS. And the reason for that is each one of the users that are working on these collection list items, whether that's just you as the biller or maybe you as the biller have other people in the office that are assisting you with it, but each one will see their own collection list. So you can really set up, tasks for multiple people through here. And click on Add Items on the upper right-hand side. And then it will present you with the items that you're going to add into your collection list. Once the list is created, you would go back into Collection List, and this is what it looks like. It'll show you all of the information for what you've requested. You can go in and you can sort things by just clicking on the column at the top of the screen. Now, when you go in to experiment with this, if you haven't used it already, make sure that you put check marks. I've highlighted them up there where it says Show All Ticklers. And I did exclude deleted. I don't care about ones that I'm not pursuing anymore. Otherwise, you'll get to the screen, it'll be blank. You can then go in, sort these ticklers, and once you put them into this list, you're going to take action on them. So the idea would be is you're organizing your AR in a way that allows you to attack it instead of being presented with pages and pages potentially of aging that you have to weed through. You're going to use your Medisoft software to organize it and then work it there. And if you have any more questions about the collection list, just let us know or shoot us an email. If your patient balances are an issue, certainly you could have researched them and put them into your list as well. But I wanted to mention that in that MGMA survey from 2015, they asked the better performing practices how they did so well collecting patient money. And the two top answers here, which I liked a lot, were they assisted the patients in making financial arrangements, and they provided online billing and payment capabilities. So that's like two different areas you can really attack. First is working with the front desk so they know what to say when a patient, and they're comfortable talking to a patient about a past due balance or collecting that copay right up front. Also, if you use Bill Flash or a statement service to send your statements, you can provide a link where patients can go to the web, go ahead and type in that web address and pay their bill online. The front desk needs to make sure they collect copays at every visit. And one thing I read in one of the blog posts there at MGMA mentioned that, if you missed two $50 copays a day, that adds up very quickly to about $25,000 a year. So you have to be very diligent about making sure you know the copay and collecting it at the front desk along with as much of the past due balance as you can. You can check the patient's balance at check-in. It's right there in Medisoft. When you're in office hours, on the left-hand side, it's showing you the balance due, the remainder due. And you also should be able to see the copay if you're checking eligibility. Last month we did a webinar on eligibility service available from Relay Health. If you don't have it or you haven't used it, let us know. We'll help you get it set up. If you'd like to accept credit cards at the front desk, if you're not doing it already, the bill pay service, which is the same company, Bill Flash, you can swipe the patient's credit card. You can also collect cash or whatever. But when you use credit card, the information goes directly into your deposit list right in Medisoft. So it captures that right away. You can print a receipt and you're all set. We talked about the fact that at check-in, if you know what your policy is as far as collecting monies, and everybody in the office knows what the policy is, you're going to offer payment plans or whatever you're going to do, make sure that it's just a very comfortable conversation for the front desk. Now there's a brand new service available from Relay Health I'd like to show you, which is called Office Estimator. This is the ability to enter into the website the patient's expected CPT codes that they're going to be billed for. You could do this before or after the patient visit. You could estimate upfront for a procedure, perhaps that the patient is going to come back for in the future. And most of you, I think, who have had any dental surgery, if you've ever gone to have a root canal or tooth removed, frequently the dentist office is way ahead of the medical offices on this, where they have already checked your insurance, they present you with an estimate, and you must pay a good portion of what's going to be charged to you before you even get your tooth fixed. So I think it's time for medical offices to take advantage of that. And the patient office estimator will give you the up-to-date deductible and co-insurance. And then you can print out an estimate right from there for patient, hand it to the patient, so the patient already knows how much it's going to cost for the visit or the procedure. And it does have an ability to add what's called a prompt pay discount. So, you're asking the patients to pay perhaps what they're going to owe right up front, and you can offer them a discount, maybe 5 or 10% if they're going to pay that money up front. This is a screenshot from the new Relay Health Patient Estimator. And as you can see, right about in the middle of the screen there, it says procedure code 10060. You can type in the procedure code here. You can have favorites that your office bills over and over if you have multiple codes there. And the front desk or whoever is going to be preparing the estimate for the patient would select the procedure codes and then enter in the member ID for the patient. And then click, Get Estimate. This is the results. It takes just a couple of seconds, but the estimator will grab, and you can see on the left-hand bottom screen, it'll show where the patient is as far as their deductible goes, whether they have coinsurance for this particular procedure code. And in my example here on the right-hand side of the screen, you can see that the total charges for the day were going to be $192.64. The payer is going to pay $167.64, so the patient only owes their copay for this visit. But if this were a procedure that you were planning, perhaps it's going to be a physical or a, an injection or a treatment that you're going to do, then you would see what the patient responsibility is going to be for those CPT codes. You could put a check mark next to where it says prompt pay discount. This office thinks that they're going to give a 10% discount if the patient pays immediately. And then at the bottom, you'll see it says print payment summary. So you can print that out, hand it to the patient, and if your office has the policy that the patient needs to make their payment before the procedure, you can go ahead and accept that money right away. You've also got the ability to click View Eligibility, but that eligibility is available to you in Medisoft already if you've got that turned on for your Medisoft. I mentioned at the beginning of the webinar that we would have the ability to request this professional assessment. And by professional, I mean it looks just like the screen capture you see there on your screen, where you submit your numbers to EMDs and they will give back to you a professional evaluation of the health of your financial situation in your practice. So if you're interested in getting one of those, please just email us at sales@avsmedical.com, and we'll communicate with you, tell you what we need to do, and we'll get that off to EMDs. There is no charge for that. Also, if you're interested in any of the services I mentioned during the webinar, whether it be eligibility or that office estimator or bill flash or bill pay, anything like that, we've got all kinds of information, little videos, and we can get you as much as you need. Just shoot us an email at that same email address. And Lloyd, if you're there, maybe we can open it up for questions.
I am here. Yeah, great job, Cindy. Thank you. So if anyone has any questions, if you will click that little hand icon, I can unmute your phone line, or if you prefer, you can just type your question into that chat box, chat window, and we'll answer that out loud for everybody to hear. So we'll kind of just sit quietly here for a few seconds and see if we have any questions.
Lloyd, do you want to tell us about the recording?
Yes. Hang on, though. There's a couple of questions here in the chat queue,
Oh, okay,
so let me
great.
just repeat those.
Great.
So the first question is, where would you view the eligibility in Medisoft?
Well, we have a nice webinar. If you would send us an email, we'd be happy to send you a link to it, and it shows where you would see the eligibility results there. Once you have that turned on, it's actually available under each. If you go into the case, there's a button there that says eligibility, patient eligibility. It's also available on the patient's appointment in office hours. You can right-click on any appointment and say check eligibility. If it was done by scheduling it, which eligibility can be a task schedule that's done a day or two ahead of time, then the results will appear with a little flag in every single appointment. So just shoot us an email. We'll get you the webinar information. You can take a look at that.
Okay, great. And hi, Elizabeth. Did you have a question?
Yes, I would like to know the fee for the Relay Health eligibility.
Okay. So that's an interesting question. There's a couple that had chatted that same question in, so we'll go ahead and answer that. Cindy, you want to answer the question?
Yes. If you already have Relay Health, you may already have eligibility in your bundle if you signed up with them. I know that when we sign up all of our Relay Health clients, if you signed up with us, we would have it in there. So there is no additional price for eligibility if you had it in your bundle. So just go ahead, Elizabeth. I'll mark down and check for you to see. But you have it. You may only need to have it set up, and then you can work with us, and we'll help you get it set up.
Okay, thank you.
Thank you for the question. And Cindy, you wanted me to mention the recording. Yeah, the recording.
Yeah.
If you've registered for the webinar, which everyone here, of course, has, you will receive an email from us tomorrow with a link to this recording, along with a link to the slides. So you'll have that by tomorrow.
Okay. Someone else asked also, Lloyd, about the price on Office Estimator and bill pay.
Okay. Yeah.
Okay, so that did you want to answer that?
Sure. Well, you go ahead and take the estimator, and I'll take the bill pay.
Okay. The Office Estimator can be added on to your Relay package. So I would say that if you already have Relay Health with us, the price may vary. If you do not have Relay Health yet, and you just wanted Office Estimator, the price is $60 a month. And that gives you the ability to go ahead and, do that estimate for every patient coming in. So I think it's, it's a bargain for that. And Lloyd, do you want to go ahead and take the pricing on bill pay?
Yeah, so bill pay is, bill pay is part of the Bill Flash suite of services. Now you have Bill Flashes already in your software. Bill pay is the online or in-office ability to have a patient pay with a credit card or a check. They can pay with a check online too. And the costs for that are really just the credit card processing fees, and it depends on the type of credit card that they use. So these days, most people use some type of a what's known as a rewards card. So like if you're getting a cash back or points or something like that, that's a rewards card. The fees for those are 2.8% plus 19 cents per transaction. If it's not a rewards card, I think that the rate is less than, well, I don't think it's less than 2%. I don't recall what it is. It's 1.5 or 6, something like that. So that's really the only charge for those. But they've got some great features in there. The one that I've seen help out some of our clients tremendously is now you can have the ability, particularly with patients who you have on a payment plan or would like to put on a payment plan, they owe you a lot of money. You can just negotiate what that payment schedule is, take their credit card, and then bill pay will automatically charge their card. So if you've agreed that they're going to pay you $100 a month, you can just set that up for 10 months, 8 months, 12 months, whatever it is, and it'll just automatically charge them, and it shows up right in your right on your deposit list in Medisoft. And there's no, again, it's just a credit card processing fee. There's no extra charge for that. And Carolyn, yes, we will check to make sure to see if you have the eligibility set up in yours.
Yeah, I see that question, Lloyd. I'll go ahead and get back to Carolyn on that.
Okay, great. Well, I don't see any other questions coming through either by phone or in the chat window. So we'll go ahead and kind of wrap it up here. We've been just about 35 minutes so far. Again, this will all go out in an email tomorrow along with the questions. You'll have a recording of that as well. Please contact us if you have any other questions. We again thank you for your time this afternoon. And again, keep an eye on our blog. We're going to start doing a bunch of mini, we think of them as mini webinars. They're not going to be like this where they're live, but we'll do recordings on best practices. As an example, what's the best way to send statements out of Medisoft? What's the best way to post payments, etc. A lot of, we've seen over the time that not everybody, a lot of times people aren't doing things in the exact way that they should be done, and we're here to try and educate and improve things. Here's a good question. Our previous webinar is available on our website. So yes, avsmedical.com, and when you get there on the right-hand side, there's a link that says blog, And if you go to the blog, you'll see all of our webinars there. The webinars there, we kind of mix them together. There's a lot there about practice management. There's also a lot there about the electronic medical records. So if you're not using one of the EMRs, those may or may not apply to you, but you can search, or not search, but there's links there for Medisoft, et cetera, and you can find those. So that's a great question. Yeah, they're available on our website. And when you get to that blog page, again, I'd encourage you to just put in your email address. That'll automatically subscribe you. It's not marketing or sales stuff. It's all just educational things that are posted on our blog page. So great question. Thank you, Raj. Okay, well, with that said, once again, thank you for all of your time this afternoon. We enjoy doing these, and we hope you enjoyed them as well. So I'm going to go ahead and end the webinar now. Thanks, everybody.